Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? This is a solo episode, so it's just me, and I'm so excited to get to talk to you guys, just us. I always have guests on, and I love having guests on, but I feel like sometimes there's some things I don't get to talk about. So for today's episode, I'm going to go over misinformation and misconceptions about your plastic surgery journey. And I'm so excited to talk to you guys because I feel like this is something that people don't really talk about. And what am I here to do but talk about all the things that nobody wants to talk about? So let's get started. You're going to see me looking down and you might hear me writing and jotting my notes, but I wrote down some of the things that I hear and kind of how I handle those types of things. Like, for example, one of the things that I hear all the time is, I'm afraid to have plastic surgery because I'm afraid I'm going to get botched. And although there is the reality of women getting botched, it's not, I wish I could say for sure it's not going to happen to you. I can't say that, but what I can say is that when you go to a board-certified plastic surgeon who specializes in the procedure that you are interested in, it's very unlikely that you will get botched. So why did I word it like that? I'll tell you why. So you have had about 10 guests on the show talk about, maybe not 10, maybe more actually, talk about the board certification process and how there's surgeons or doctors out there doing cosmetic surgery, but they're not licensed or they weren't trained to do cosmetic surgery. So, for example, you can have, which we do here in Houston, and I have beef with him, so usually I don't talk a lot of crap, but for him, I'm going to, because the amount of women that I've met who have gotten botched by this guy. And actually, you know what? I'm going to freaking say his name. His name is Marcos Ikeda. Ikeda. First name Arcos. He's a gynecologist who decided he was going to do cosmetic surgery. He's here in Houston, and he's not a board certified plastic surgeon. The reason why I have beef with him is because he targets Latin women. He targets the Hispanic community because he's a Spanish speaker. And I don't want to talk crap about, I don't even know how, I do want to talk crap. How can they target my Hispanic women, my Latin women, when you're not even supposed to be doing the surgery anyway? And it ticks me off because I get to hear the women who he botched cry, be desperate to get the surgery fixed, and now they spent all their money on this surgeon who's not even cheap. He's not even cheap. It's not like he's giving surgeries away under $10,000. No, he's charging up in the teens or young 20s, early 20 range. He's charging for what? For botched work. So it is a reality that you can have plastic surgery and get botched, but how do you counteract that? By going to a surgeon who's been trained in plastic surgery. I know there's this whole gimmick, I want to call it. We've had Dr. Stevens come on, the president of the Aesthetic Society, talk about how the cosmetic surgery board is a made-up board. It's not even recognized by the American Board of Medical Specialties. So I don't want you guys to get confused with a cosmetic surgeon and a board certified plastic surgeon. If you look at somebody's Instagram or website and you see that it says double board certified, I would probably start asking, double board certified in what? Is it gynecology and cosmetic surgery? Because, okay, neither of those are like 100% for sure that they're going to do good liposuction on you or a good tummy tuck, that they were trained. And a double board certified in 2 specialties, and one of that specialties is not plastic surgeon, run. I hate to say it, but run. There's so many good board certified plastic surgeons. There's no way and there's no reason why you should be going to a cosmetic surgeon. I don't care about the results that they post online because a lot of that is fake. They Photoshop them. A lot of those before and afters are on the table. You don't even know how that incision's going to heal. Like this guy, I've seen some of his incisions after they've healed, some tummy tucks after they've healed, some breast surgery after they've healed, and it looks terrible. Let me give you guys a good example of how I perceive this, and I'm going to use this guy that I'm talking about as an example. So you guys know I have a lot of friends in the industry, and they all talk to me, and they know, hey, you want to know about somebody? Talk to Mavi. So one of my massage therapists who was taking care of one of my one-on-one clients, and I was there with her, she was like, hey, have you seen the work of this guy? And I was like, God, I don't like him. And she said, oh, I understand why. And she pulled out her phone and she showed me a I couldn't see the face of this person. I could only see the body. So I don't know who it was. I don't know this person's name, but all I know is that she showed me a picture of the breast, and the woman was coming to the massage therapist looking for help. Like, hey, he says that if I get enough massages, this fat's going to go down or this spot's going to go down. But that's only swelling can go down. Unless you're doing some sort of like body sculpting therapy, massages are not going to make a lump of fat that they missed or he missed go away. And this, unfortunately, is the reality for a lot of women. So this poor lady, she had a mommy makeover. So he screwed her on the breast because he only did breast implants. And now the breast implant is up here and the rest of her breast tissue is hanging off of it because she actually needed a lift. But since he's not a real plastic surgeon, lifts are not money makers. They're not, you spend a lot of time sewing. You have to be very skilled at doing a breast lift. You can lose your nipple. There's a lot of reasons why I'm sure he decided not to do a breast lift, but the patient needed a breast lift. So instead of being ethical and saying, hey, a breast implant is not going to give you the look that you're looking for, you actually need a breast lift. I don't do breast lifts. You can go see this guy. No, he decided, I'll just do the implants. So now has breast implants, but her breasts look deformed because she actually needed a lift. So she's got what they call like a double bubble, breast implant up here and a mound of tissue hanging off of it. So that was issue number 1. And I'm already like, God, this man, I can't stand him. And then she goes to show me the results from the tummy tuck. Thank God everything healed and closed and there's no open wounds. There was none of that. But the result was that of somebody who had a tummy tuck and had no liposuction at all to accentuate her waist or to remove any fat spots that make the stomach look uneven. So from the side, you can see like where he cut, and then you can see the bulge of her mons because she needed liposuction to her mons, but he didn't do that. And you can see on her flanks that she has a muffin top. Well, it's because he didn't do any liposuction. So now this poor lady has a tummy tuck and a breast implants when really she needed a breast lift with breast implants and a tummy tuck with liposuction to the flanks, to the back, to the mons. And so now this poor lady was upset because she spent all of the money she had saved for surgery and her body looks worse than what it did before. So that's the reality of the things that I encounter. Those are the type of things that I hear. And I hear so many things. I mean, I've heard of surgeons who are not board certified plastic surgeons puncturing lungs, puncturing livers, liposuctioning livers because they aren't skilled enough to know where they are. Liposuction is not like, oh yeah, anybody can learn how to do liposuction. No, it takes a lot of skill to learn how to do it. And it's kind of a trial and error until you figure out how to do it right. So I can't emphasize enough how important it is for you to see a board certified plastic surgeon, not a cosmetic surgeon, but a board certified plastic surgeon. And I know I might get some heat from this. I've gotten messages in my DMs where patients are like, but there's this guy that does amazing work and he posts pictures on Instagram and his results are amazing and my friend went to him and she's so happy. Okay, go ahead and see him. But when something happens, don't come back and say, I should have listened, because I can't tell you. And maybe I should have one of those patients on. How many women I've had come to me and say, man, I really should have listened when you said not to go to a cosmetic surgeon, to only go to a board certified plastic surgeon, because now look at what I'm dealing with. I had a phone call yesterday with the patient who traveled to Colombia to have surgery. And there's nothing wrong with going to Colombia to have surgery, but every country is dealing with the same issues that we're dealing with. Surgeons or doctors who are deciding that they want to do cosmetic surgery, but they're not really qualified to do plastic surgery. So this patient, she had a mommy makeover with a doctor who was actually an ENT. And she didn't find out after she had already traveled all the way to Colombia, had already paid for everything, had already done everything. She's finding out during her pre-op that he's actually an ENT. And then he told her, but don't worry, because my partner who specializes in liposuction is going to be in the room with me. What is that? Okay, I get it. I understand. But no. So now this girl I talked to yesterday, she's 2 years out from surgery. And she's still draining from some of these incisions. She's still having issues. She's still swelling, very big swelling. I don't know what's causing it, but I do know that if she had gone to see a board certified plastic surgeon, maybe that would not be happening. And I know that cost is always a factor for a lot of women or patients who are looking for surgery. This isn't the time to skimp. This isn't the time to find a deal. This is the time to sit down and make a plan and come up with a savings plan, or if you want to apply for financing, if you want to put it on a credit card, a low interest or no interest credit card. This is the time to problem solve how you're going to be able to get the money together to have the surgery that you're looking for. This isn't I only have $10,000 and I want to get all of these things done at the same time, or I'm going to travel to another country. Because let me tell you, even in other countries, surgery is not cheap anymore. I had a patient who just went to Mexico and she ended up paying about 18 grand for her surgery. I had a patient who just went to Colombia and she paid 19,000 for her lipo 360 BBL. It's not that much cheaper to go to another country. And I'm talking about like the whole process, flying, everything. Other countries are not exempt from the same problems that we're having. They're having the same issues. I've seen news reports. I've seen other people who are trying to draw attention to this, especially in Colombia, especially in Mexico, where patients are getting hurt. Talk about another fear that I hear a lot, or misconception, misinformation. Anesthesia. Anesthesia, every surgeon is different on how they do their anesthesia, but my recommendation would be to always make sure that you're having surgery with an anesthesiologist. you can ask your surgeon. Don't be shy to ask these questions of who is doing my anesthesia. If they say it's a CRNA, you are completely in your right to ask, is there an anesthesiologist going to be there on site when I'm going under? That's the most important part. CRNAs are amazing, gifted, talented, very educated, but there should always be an anesthesiologist when they're putting you to sleep and when they're waking you up. It's totally up to you if you are okay with having a CRNA, but here in Texas, there should be an anesthesiologist on site when you are being put to sleep and when you're waking up. The rest of the time, if they're just on the premises, it's okay. But when you're getting put to sleep, it's very important. There's a lot of surgeons places who target women who are afraid of anesthesia, and they tell you, we do it all under local. You don't need anesthesia. It's all under local. There's definitely procedures that can be done under local. Small areas of liposuction, chin lipo, upper blepharoplasty, a little bit of liposuction in one area. But definitely not a whole tummy tuck or a whole lipo 360 BBL under local. There's no way that the amount of lidocaine that can be used in one sitting is enough to numb a whole abdomen for a tummy tuck. There's just no way for you not to feel it. So then we go into other problems, which are lidocaine toxicity. If you have watched the news at all, you know there's a plastic surgeon in Florida who's dealing with this problem right now, who was doing liposuction on his wife, and the wife died of lidocaine toxicity. I don't have the name. I don't know the name off the top of my head, but I'm going to tag it in the show description for this episode because I want you guys to read it. So even a plastic surgeon who was doing liposuction on his wife injected too much lidocaine and she died from lidocaine toxicity. Nobody needs to be losing their life over plastic surgery or over cosmetic surgery. I don't want to have people losing their life because they want to look better and feel better about themselves. It is your responsibility to make sure that the person you're trusting to do your surgery can do it right and is doing it ethically and is doing it with your safety in mind, not money in mind. And how do you make sure that they're doing that? Well, for one, you go to the abs.org, American Board of Medical Specialties website, and you can search your surgeon by name, state what specialty they tell you that they're in to see if they are board certified. You can find out what certifications does a surgeon have. Are they a pediatrician? Are they a gynecologist? Are they a dermatologist? You can find out exactly what certifications they have. And then the decision is up to you. Do you still want to continue having surgery with this person after you find out what certifications they have? If it says American Board of Plastic Surgery, you can rest assured that if they are board certified plastic surgeons, they're handling themselves at a different level, ethically, professionally, because the American Board of Plastic Surgery is very, very strict with what they allow. They keep a very close eye on their members. Surgeons keep that board certification is very, very important to them. So they want to keep it. So they make sure to abide by all of the rules that the American Board of Plastic Surgery gives them. Professional rules. I don't know if you guys remember the episode I did with Dr. Miami early last year, where we talked about how he was the first surgeon on social media like Snapchat, posting surgery, going all into it. And if you guys go back and listen to that episode, he talks about how he got a letter from the American Board of Plastic Surgery talking about giving him a warning about what he's doing online, posting videos and showing the surgery and all of that. And then the next year, he was invited to talk to other plastic surgeons about posting online. Although they were later on board with him posting on social media, initially they did send him a letter, and it's because they're keeping an eye on everything. They're making sure that the surgeons who are board certified by them up to par with their regulations. So my number one tip is make sure that you're going to a board certified plastic surgeon if you don't want to get botched. I'm not saying that just because they're board certified, there's not a possibility of you not being happy with the surgery that they do or that the results that you get. But I believe that you're definitely not going to get very, very nasty, ugly infections and botched and missing nipples and all of that stuff that can be really, really hard on you after surgery if you are unhappy with your results. One of the other fears that I always hear is I'm scared of looking fake. And I'm scared of having if they're going to have a BBL, I'm scared of my BBL being too big. It's like, girl, the BBLs that you see that are too big, those are 2 rounds, 3 rounds. They've had multiple surgeries to get it that big. In one sitting, it's quite difficult to get really large BBL results in one sitting. Most of the time, those results take time and they take multiple surgeries. So it's not like an accident. It reminds me of when patients come in to get filler and they're only going to get 1 syringe and they're like, but I don't want to look fake. And it's like, girl, in order for you to look fake, you would be spending quite a bit of money to get enough syringes for you to look fake. 1 syringe, 1 cc is not going to do that for you. That reminds me, I want to tell you guys, I cannot wait to tell you about the treatment I just had done on my face. I'm actually going to be doing a whole episode about it. But today, I'm still a little bit bruised. I'm still a little bit swollen, but I'm super happy with the results so far. It's a procedure where they draw your blood. The brand name is called Easy Gel. But what it is they draw your blood and they turn it into a filler, but they don't have any additives. So it's just your blood at different temperatures to change the consistency of the cells. And then they re-inject it into your skin. So I had it underneath my eyes. I had it on my cheeks, down here by my mouth and my chin. I had it all over my face. And if you want to see a picture of my face super swollen the next day, you have to send me a DM on IG and I will send it to you on Instagram. Send me a DM, say, hey, I want to see your swollen face after the Easy Gel treatment. And I will send you a picture. I'm not going to post it online because I look ridiculous. But now that the swelling has been going down, I'm so in love with the results. I'm so happy. I can't wait for you guys to see the results and also to hear from the company so we can really, really get into it about all the specifics, because Easy Gel is definitely going to be one of those treatments that I'm going to be doing every year for the rest of my life. To wrap it up, let me wrap it up. When you're looking for your plastic surgeon, it's really important to make sure that you realize that this is one of the most important decisions that you're going to be making. It's like picking a partner. It's like picking a husband. You're about to trust that this person can do a good job on your results, keep you alive, keep you safe during surgery while you're under anesthesia, and also hold your hand during the recovery, which is just as important as everything else. Holding your hand during recovery is crucial for those results. Trusting your surgeon is also very, very important, because if you don't trust them when they tell you this is just a little bit of swelling and you don't think it's swelling and you really think it's something else and you don't trust them, you're going to have anxiety. You're going to be anxious. You're going to be Googling. You're going to be asking Facebook groups. And that's seriously what leads you down the wrong path of being happy with your results. So when you're looking for your surgeon and you don't know who to go to, that's actually why I launched part of my brand, part of my business helping women find the right plastic surgeon. And not just helping women find the right plastic surgeon, but helping them through the whole journey of preparing for surgery, finding the right surgeon, preparing for recovery, and getting through recovery. That's my favorite part. Holding your hand through the whole process is my jam. I love it. So I offer it. This is one of the services that I offer. I don't really talk a lot about my services, but I do offer one-on-one services where I help you with the whole process. We have different packages. I have a package where it's just me. That's my surgery blueprint package. And then I have a package where it's me, a nutritionist, a mental health coach, and a concierge coordinator who helps you with all of your stuff. And then I have another package, which is my VIP package, where you get the whole team, the nutritionist, the mental health coach, the coordinator, concierge, and then you get me to come with you for your surgery. So if you don't have a travel companion, if your husband can't go and you don't want to go by yourself, you can hire me and I'll come with you. That's the end of the episode. I'm so excited I get to see you guys, talk to you again. I've taken a little hiatus for the last few weeks. I had a lot of things happening. I was traveling to the aesthetic meeting, which is going to be a whole episode by itself because it was so much fun. I got to catch up with all of my plastic surgeon friends. I got to learn so much. I got to be there with Pop Recovery, and it was such an amazing experience to wear my badge for Pop Recovery Systems, and at the bottom it said first time exhibitor, and it just gives me the chills because 4 years ago there was not that much out there to help you through surgery. And through this time of the last 4 years since I launched the show, we have grown. Our numbers have grown tremendously. I have listeners all over the world. Not only listeners, but I have friends. You guys become my friends. When I talk to you in my DMs, I love hearing from you. I love hearing about your surgery. I love hearing about your recovery. I love hearing about how your life is changing. That's what I love. I love it. Hearing about, I used to dress so shy and I never wore form-fitting clothes, or I hated show, to now I get pictures and they're sending me pictures on the beach in their bikini and they're like, oh my God, I'm so happy. My husband loves my surgery. He says I'm so much more confident in life. My kids are happy. They can tell I'm happier. And those comments and those messages, they just make my day, because I remember when I had my surgery and how my life changed. And when I made this podcast, I thought to myself, I want to help as many women be as happy as I am and how I feel right now. If I could help more women feel how I feel right now, I know I'm making a difference and I'm making a change in our world, because our happiness is infectious with the people around us. So if I can make one person feel happier with herself and the people around her, it's a domino effect. How many people are we really impacting? So I love hearing your stories. Don't ever stop messaging me. Don't ever stop DMing me. If you do not hear back from me right away, you will hear back from me. I have tons of DMs, but I go through them. If it's from somebody who's having a transformation, who's talking about their surgery, I'm reading it. So don't ever stop. And with that, I want to tell you guys, I will see you on the next episode. All right. I love you. Bye.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations, and I really get to know what your dreams are and what you're really looking for with your body,
I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information. Let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.